people don't have malls to do that, but it's certainly a great idea. And by the way, in passing, I had someone ask me coming in, because last time we got together, the topic came up, asked me how my mom was doing. So, for those of you who may not recall, I am very fortunate and very blessed. Last November 18th, my mom turned 100. And I was coming back from a Salem County Veterans Memorial Day ceremony yesterday and stopped by in Rosenhain, little town of Rosenhain where I grew up, to see her. And she was writing out some notes, and she was cooking something, getting ready to cook something for dinner. She lives by herself, and I'm very fortunate. So for those who were thinking of her, thanks for asking.
Congressman, we actually do have several questions that we've been collecting. Mary Beth Dixon is collecting these cards, so feel free to continue filling out and writing down your questions, and Mary Beth will collect. Mary Beth is right here in the back of the room. She's showing you the card that's in your folder. So I will go ahead and just read. We have one here that's requesting your opinion on what looks like is called the Windfall Act for federal employees. And I guess specifically to the point of Social Security beneficiaries who've worked over 20 years in private, and wanting your opinion on whether or not you think it's fair.
I'm a co-sponsor of the windfall elimination. This is something that's been in place for a long time. Folks are how many in this room are affected by this? We've got one. Windfall elimination. Federal employee windfall elimination. You're penalized in a way that you shouldn't be, and I've been a co-sponsor for the last couple of sessions. I don't know how to predict whether it will come up for a vote or not, but I think it should be corrected, and I will happily vote for that correction.
I think what bothered, well, first I want to thank you. We had a little problem with our Medicare benefits, and I contacted your office, and very helpful, and got everything straightened out. I want to thank you for that. But being a federal employee, if we don't pay Social Security. It used to be. Now it's different under FERS program. But I worked like 20, 25, 22 years in private sector. A person that worked that long and wasn't a federal employee got full benefits. When I was retiring, I was supposed to get $900, per figure. But because of being a federal employee, I got $400 and some dollars. But the thing, it bothers a lot of people. We were postal employees, and of course, we're the ones that got hit pretty heavy. But when I pass away, the rules with Social Security, my wife will get the full benefit. She'll get what I should have gotten when I was. Now there's two people living on $400, and when I pass away, she'll get the full $900. That's the law. And it was brought out by Social Security. That's how it works.
That could also make for some tension in the marriage. No, it's absolutely right. That's the problem. That's why it needs to be corrected. And thanks for the comment about the help from the office. Pat Poole is sitting right here. Pat is from our district office, and she will be around if anyone needs to talk to her about specific casework or problems that you may have with the federal government. But as a reminder, if you have any problem with any aspect of the federal government, you should call us. You should give us a chance to try to fix it. A lot of Medicare, a lot of Social Security, immigration, VA, these are all the things that we try to untangle.
The next question is, what ideas do you have to bring down the cost of health care for people on Medicare?
Well, bringing down the cost of health care for people on Medicare is what we just talked about. This health care reform bill that the nation is eagerly awaiting is supposed to reduce the cost of health care. Now, we don't know the particulars, so where it's a huge bill, covers the whole entire United States of America, but this was one of the things that was designed to do that. We've touched around the edges with children's health insurance. We've touched around the edges with helping take the pressure off of emergency rooms with community health centers. we have a number of them in South Jersey that have helped tremendously, providing good quality health care so that people who are uninsured don't have to just go into an emergency room. If you go into an emergency room and you get so-called free health care, it's not free, somebody's paying for it. So puts pressure on the hospitals. The hospitals are in a terrible position because that comes under the term of charity care, and I don't want to quote the exact number, but they're only reimbursed something like 10 cents on a dollar for the charity care that they give out. So if someone is uninsured and they feel the need to have medical attention and they go to an emergency room, it's very, very, very expensive. Community health centers have helped that. But the comprehensive plan that the President is talking about is designed to bring this cost down even more dramatically, and that's what we're all waiting to see.
Thank you, Congressman. The next question is, how does the new health national plan affect Social Security and any Medicare? Does it react on military retirees? Why doesn't the government add stimulus money back to Social Security, which they borrowed before?
Well, we don't know how it's going to affect Social Security or Medicare. We don't have any answers of how it's going to affect anything because we don't have a bill. All we have is an idea. We have a good idea that health care needs to be reformed and looked at closely, but how it affects Social Security and Medicare are key and essential to what this legislation is going to do, and that's where AARP will be really invaluable to me in understanding these components. And as far as stimulus money is concerned, how should I say this? This was an idea. The country still has some massive financial and economic problems. The stimulus money is designed to help get people back to work or to keep people in existing jobs. That's what the idea of the stimulus was. Unemployment rate is going up, people are being laid off, people are losing their jobs. So how do we stem that tide and keep more people working? Well, this was one of those areas where I don't know how anybody could feel good about the process. As members of Congress, with the exception of maybe 5 or 10 members, we were given a bill that was in excess of 1,000 pages, in excess of $1 trillion, and less than 10 hours to look at it. Now, you heard the report last week, probably like I did, that millions and millions of dollars in checks are going out to people who've been dead for a long time. Not a good idea. Billions of dollars went to STD clinics. Maybe these clinics need help, but they're not in the stimulus bill. Hundreds of millions of dollars to how to improve weather forecasting. I'd like to know exactly what the weather's going to be, 7 days from now, but
people in Oklahoma, Congressman, they're the ones that need something like that.
Well,
we're dying every year, Oklahoma,
they
Kansas.
they do, but I'm not sure the stimulus bill was the right place to put it. So how to answer why the stimulus didn't do certain things, that was given, Congress was given an up or down vote. No ability to amend it, no ability to debate it, no ability to discuss it, no ability to change it.
That was mine. I didn't have much room to write it on there, but the stimulus shouldn't have been put in there. Am I wrong that the government didn't borrow money a long time ago from Social Security, take it out of the Social Security fund?
And they did.
Yeah. Did they ever pay it back?
No.
And now it's short. But the government could come up with all this money now for stimulus for everything. Why couldn't they have in the past put money into Social Security instead of telling us it's gone broke?
Why did they get out in the first place?
Okay. The next question reads, I read that a commission to propose a healthcare plan will bring a whole package to Congress to vote yes or no and not change parts of the plan. We have not addressed the profit motive in insurance companies. We already have a third party deciding healthcare, the insurance companies. So it's
Well,
not.
that's more of what we've been talking about, that we're not sure whether the legislation, when it is finally proposed, the normal course for